Awesome. Thank you so much. Sunny, are you diving in, or are we just live here?
I was about to dive in, and then
I'm going to introduce you. This is Sunny Saran.
No, Joanne jumped in, so I was like, anyway, sorry about the confusion. Good afternoon, everyone. Welcome back to our spotlight session. The focus of this panel is going to be about emerging opportunities for HIT job or internship seekers. And we're featuring two leaders from two distinct organizations. However, all three of us have something in common, the UCLA, and more specifically, we all have a connection with UCLA Anderson. So I would love to introduce Dave Whelan. Dave is currently the CEO of BioscienceLA that's doing some great work here in LA. And that's one of the reasons we wanted to have him, because we wanted him to talk about what he's doing, how he can help businesses and also internship job seekers make some connections. So I let him speak more about it. Also, Dave is passionate about building businesses and inspiring entrepreneurs at the intersection of technology, health, and wellness. Thank you, Dave, for taking the time to be here. And I also would like to introduce Kevin Baldwin. Kevin is also a member of HIMSS Academic Alliance Committee. He's an adjunct professor of Health Information Systems and Technology, UCLA Fielding School of Public Health. Also, Kevin is a strategic higher education and health services leader with broad experience in people development, information technology, process improvement, strategic planning, and service and quality. With that, I will turn things over to Kevin and Dave. Thank you, gentlemen, for being here. It's back to you.
Great. Thank you so much, Sunny. Really excited to be here, and always fun to have an all Anderson team coming together. So a little reunion of sorts. I just want to give a quick introduction to both myself, but really more of the organization. I've been in Los Angeles for 20 years, as Sunny said, building businesses at the intersection of technology, health, and wellness, from wearables to genomics to health data, including working with the Cedars-Sinai Accelerator from the very first class. Last year, in fact, last Monday, March 16th, day we all remember here in California, I took over as CEO of an organization called BioscienceLA, which is a 2-year-old independent nonprofit organization designed to really raise the profile and the innovation capacity of life sciences and health tech in the LA region, growing funding, growing space, growing talent, and really growing awareness of the entire industry. So super excited to share more about what we're doing and really connect it to the HIMSS story and a lot of the work going on here, especially around workforce. But before we dive into that, Kevin, would love to have you tell a bit of your story.
Yeah, thanks, Dave and Sunny. Great to virtually see you guys, and hopefully we'll all get to see one another in person someday very soon. So to give everyone a little bit of my background, I've been in healthcare for about 15 years now, and actually I did not start out on the technology side. I started out working in more operational and research roles within health systems. And when I saw I'll call it the healthcare technology tsunami coming about a decade ago, after the Affordable Care Act and the High Tech Act, started to really incentivize the adoption of EHRs, I transitioned and pivoted into technology at that time. And it's funny, back then when we actually were implementing the EHR at UCLA back in 2012, I remember people were worried. They were saying, hey, so once we get this thing in, what's next? Like, are we all going to lose our jobs? Like, what do we do next? And lo and behold, there's always new innovations and optimizations and projects coming in technology. So I've stayed busy, and I think all of you are in a great place to be here today and to be interested in, and many of you probably working or studying in healthcare technology as well. And I actually say the timing is probably quite ideal. There's this I don't know, convergence, I guess, of interest and ideas and expertise and investments, and Dave can speak to that as well. In this very area, across a myriad of different specific opportunities within the healthcare system. So in any case, I think Dave and I, we wanted to share a little bit of our perspectives just about the greater, LA health tech ecosystem, maybe, how we got to where we are today, where it's going, and some of the larger trends that we're seeing. Dave, did you want to kick us off?
Sure. Yeah. And, as I mentioned, thanks, Kevin. As I mentioned, I joined BioscienceLA last spring, and I went into what I looked at as a job that was really about innovation and kind of, connecting technologies here in LA. And that's absolutely true. But obviously, we all know what's happened over the past year. But from my perspective, I look at the last year as a healthcare crisis, which led very quickly to an economic crisis, which has then been amplified or exacerbated by multiple social crises. And I think that exists across the world and around the world, across the country, but absolutely in Los Angeles, given the diversity of the population, given the size of the population. And so with BioscienceLA, a lot of what we've been doing early on is really focusing on talent development, connecting individuals to jobs, and really starting to find a way to, one, it's about getting people back to work or getting people, more, growing in their careers, but also focusing on how can we as healthcare professionals help to solve the many problems that have surrounded us over the past year. So I don't think I've seen a moment in time where we're all more focused on healthcare innovation. And BioscienceLA, we touch on everything from biotech to medtech to digital health to health IT. And so I sort of go, bounce between the Bio International Convention and AdvaMed and HIMSS and things like that. As you mentioned, Kevin, it really is much more interconnected, both from a tech standpoint and then I think even from a business standpoint, where it's in all of our best interest to find ways to connect the dots, both link people together, link technologies together, and ultimately find ways for organizations to kind of accelerate the work that they're doing. And I know there's a couple new initiatives going on. Maybe I'll tee up one at UCLA right now, and then we can kind of use it as a springboard. This announcement, hot off the presses. So UCLA Biodesign, which is an organization that's jointly sponsored by UCLA Health, by UCLA Medical School, and then by the UCLA Anderson School, the business school that we attended. Biodesign kind of modeled after the Stanford Biodesign program, and they, along with BioscienceLA, just received a $750,000 grant from the EDA, the Economic Development Agency, that is focused on what's called a sprint challenge, which is basically different ecosystems or areas across the country finding ways to accelerate responses to pandemic like COVID. And so what we're doing here is launching a COVID accelerator that will be focused on detection, prevention, treatment, and most importantly, health equity and access. And so I'm really excited about ways that we can get some health IT, HIMSS member companies involved in things like this to help tackle COVID. And we can talk a bit more about that, but maybe Kevin, I'll turn it back to you just to kind of tie it into some of the work that you're doing at UCLA as well.
Yeah, definitely. And I second the point you made about, trying to find problems in healthcare that, we should solve or improve or reduce the costs of it, et cetera. And what I've actually seen in my career is oftentimes people will, they'll chase the solution first. They have some new technology or widget or app that they are trying to fit into the healthcare mold. But probably what works better is if you seek to understand the problem, so the clinical workflow, the reason why providers are being burnt out, the patient engagement, problem that maybe an organization is facing, and then go out and try to develop or find a technological solution to to fix that problem. And the reason I shared that background is I think that's exactly what Dave is doing and what other groups like Biodesign at UCLA are doing is they're seeking to truly understand the healthcare problems that are out there at, at the organization level, at the department level, and for specific workflows, and then finding the solutions and the partners and the technologies out there that could improve that particular situation. And what's really fascinating to me is I can definitely say 15 years ago when I started my career, there was obviously technology in healthcare, but there wasn't this keen kind of laser focus and widespread interest like we have today. And in fact, in LA alone, I probably would say we are, one of the hubs of health tech innovation, again, because of organizations like Dave's and also, to be honest, the network of individual organizations ranging from startups, that are just entering the space to established, health systems like UCLA, UCI, Cedars, USC, et cetera. We have so many well-renowned health systems that have, just they're loaded with experts and people that are very passionate about the field that would love to partner with, with technologists and entrepreneurs to solve their problems. So I think, Dave, should we have maybe about 10 minutes left. Should we share a few maybe examples with the group and then turn it over for Q&A?
Yeah, no, that would be great. And one, I'll kind of lead in with one tied in directly to that UCLA Biodesign initiative, but larger. So we at BioscienceLA last year announced a program called BioFutures, which is something which again emerged from that healthcare, economic, social crisis kind of story that I'd mentioned. And so we received some initial grant funding from LA County, and we're focusing on getting some matching funding from other foundations and corporations. But basically, BioFutures is a competitive internship program designed to introduce life sciences, health technology, industry companies, and job opportunities to really underrepresented populations in the industry. So we've been very focused on LA's community colleges, focused on Cal State colleges, focused not just on sort of your traditional bio majors who are looking for lab roles, but communications majors who might want to get involved in helping to launch a product, or IT majors who can, or CS majors who can help with a product launch. And so we announced this last fall. We've just kicked it off starting this summer, and we have already, I think, almost 20 interns signed on. BioscienceLA is subsidizing those internships, and so we look at this as really a chance to make an investment in students in LA, make an investment in the schools by raising the profile of their programs, and then because we're subsidizing this, we're really making an investment in the companies as well. And so I will put out a call for those of you out there who are part of a health IT company in Los Angeles or the LA region that it could potentially take on an amazing, energetic, enthusiastic intern this summer. We have probably still close to 100 potential applicants who are looking for opportunities. And so I'll put my email and contact in the chat here, and would love some connections there. And then you have some related programming going on at UCLA as well, Kevin, in terms of new academic programs, I think.
Yeah, definitely. And I think there's on the education front, there's this growing list of programs and training opportunities that you all might be interested in. And I would say higher education has been slower to evolve and innovate, but in the recent few years, I think they've seen this opportunity to move things online, to evolve, to be more flexible in how they offer various coursework and degree programs. And COVID obviously accelerated that and expounded that. But a few examples I wanted to share is one, I actually teach at the LMU, Loyola Marymount University Healthcare Systems Engineering program. And what's interesting about that program is it's this mix of experts from healthcare, but also from aerospace. So there's this kind of convergence of best practices in healthcare and also from aerospace woven into the curriculum. The other program that I actually teach in, and that has, I think, done a great job of, I would say, proactively adapting, but also responding to, to the pandemic, is UCLA. And obviously there's many programs and departments and degrees available there. But one in particular I just wanted to highlight is the Fielding School of Public Health. And the leadership there has actually been working on designing a new MHA program that's going to be completely asynchronous and virtual. And again, intended to make it easier to enroll in these programs, maybe for people who, can't go to UCLA campus Monday through Friday, or maybe even, live out of the LA area, or just have, rigorous work schedules and want the flexibility to be able to, study when is most convenient for them. And what's interesting about that is that the planning for that actually started before COVID. So it wasn't, driven by COVID, but obviously the timing is quite ideal. And COVID, I think, has accelerated that. And that program, I think they're going to be opening welcoming their first class this summer, and they'll have 4 cohorts per year, so you can actually also even have the flexibility of a start date. So those are just a couple examples. There's a whole laundry list. I think Anderson, obviously, Dave and I have the Anderson connection. They've done a fantastic job, the Anderson Business School at UCLA, of finding opportunities to bring healthcare to the business school and really teach the business students about opportunities within healthcare and how they can apply healthcare specific skill sets to the healthcare industry. And then there's, the industry programs like the one Dave's leading, like biodesign that was mentioned. There's also a technology development group at UCLA, which is very much trying to work, at this intersection and bridge, academic sites like UCLA with industry. The Cedars-Sinai Accelerator has been around for many years and has had great success as well in developing and nurturing entrepreneurship. So really, I think all of your biggest problems will be being very focused and deciding what you want to get involved in and how you want to spend your time, because there's literally like almost an infinite amount of opportunities that you could pursue. And the last thing I will mention that also does a amazing job of connecting people like Dave and me and all of you here in the room with us today is actually HIMSS, and both HIMSS National, HIMSS SoCal, and the Academic Alliance. They kind of their Academic Alliance's mission is to connect students and young professionals with job opportunities, internship opportunities, mentorship opportunities. So definitely stay plugged in with HIMSS. You guys are all here today, so I think that's probably the first thing I would recommend, and you guys have already done that. So kudos to you. And I think we have just maybe 2 or 3 minutes left. Are there any questions from the audience or anything that you guys would like us to elaborate on?
Dave, I was going to ask you about link how to apply. I see that you posted in the chat window. So I think that's, would you recommend if anybody's interested in applying for an internship or companies trying to apply for interns, they can submit on that, correct?
Yes, yeah, absolutely. And even though we're just kicking this off right now, and we'll be, we're focusing on full-time or part-time summer programs for this summer. Those could be virtual or in person. We have some lab roles that are happening in person, but obviously a lot still happening virtually. But this will evolve into a year-round program. So we're interested in companies that could take on a part-time intern during fall quarter or winter quarter, or students who are looking for that. So we want to continue to grow the industry, continue to help make connections. I think as this biodesign Sprint Challenge COVID Accelerator comes on board, we'd love to see companies involved with that. One more I'll just throw out to add to Kevin's long list is a new program called Heal.LA, which is being led by Larda Institute right now in conjunction with Biolabs and Gilead, or funding from Gilead, but they're very much focused on LA-based healthcare innovation organizations. And so that's not specifically biotech, that could touch on med tech and certainly touch on kind of the health IT connectivity side of things. So larda.org, I'll put that in the chat as well. You guys can take a look at that if you're interested in applying.
Thank you, Dave. I think with time up, Kevin, thank you so much for joining. Thank you for the preparation. So thank you, both of you.
Great. Thank you so much. Really appreciate being here.
Thanks, everyone. Thanks, Sunny.
Thanks, guys.